Council Board of Health meeting, October 21st, 2025, is now called to order. Please stand and salute the flag. After notice this meeting has been given in accordance with the Open Public Meetings Act, pursuant to Public Laws 1975, Chapter 231. This agenda is complete to the extent known and was sent to the Trenton Times, concerning the newspapers, posted on the first floor bulletin board in City Hall, filed in the City Clerk's office, and posted on the City of Trenton website. Formal action will be taken. Roll call. Vice President Evans.
Present.
Councilwoman Feliciano.
Present.
Councilwoman Figueroa Gettler.
Present.
Council.
Present.
Councilman Harrison, I believe, is in route, I imagine,
Yeah.
for either this or the next meeting. Councilwoman Williams.
Presently presented.
Council President Gonzalez.
Presented.
Thank you. And Madam President, at this time, if you would like to read the invocation. Almighty God, who holds the faith of the nation, we will humbly beseech thee to bless this our city, these deliberations, and these thy servants, that they may have with wisdom and understanding for the good of our community and thy greater glory. Amen. And Madam President, if you would like to introduce the Board of Health presentation.
We'll have Director Kelly before I always get to it. I'll take Director M. Is that okay?
Good evening. Dr. Davis Market. Good evening, Board of Health. Dr. Davis Kelly, the Director of Health and Human Services for the City of Trenton. We would like to thank you for allowing us to make this presentation for the Board of Health and to show all of our accomplishments for the year. So I will defer now to Ms. Glenda Grant Roberts. She is the Public Health Officer for the City of Trenton. Also to Ms. Memphis Madden, she's the outreach leader for the City of Trenton. And Ms. Janet Porter, she's the interim director for social services for the City of Trenton. And they will show you all the accomplishments for the year.
Good afternoon. My name is Glenda Grant Roberts again, and Madam President, yes, Nellie Gonzalez, Councilwoman, Jazzy Edwards, Crystal Feliciano, Tesca Whiskey, Jennifer Williams, Janet Figueroa Kesselberg, and Joseph Harrison, and who's not here yet. But my task today as the Public Health Officer is to introduce to you the Board of Health report for the year 2025. It gives me great pleasure to introduce to you our Board of Health report. At this point in time, I will quickly review the summary and responsibilities for our local health department. The core responsibilities and essential public health services of the local health department are defined by New Jersey Administrative Code, Chapter 8, semicolon 52, which is the public health practice standards. The areas of responsibility are enforcement of public health laws, state and local level, diagnosis and investigation of public health hazards, public health nursing, environmental health enforcement, monitor childhood immunizations and local school district compliance, communicable and infectious disease surveillance and monitoring, health education and wellness promotion, which includes infectious disease, chronic disease, maternal child health, injury and violence prevention, emergency preparedness and response, data collection and management, preventative health services, health-related research and continuous education, and policy development. At this point in time, I have Memphis Madden review the Child and Health Exposure and Prevention Program.
Good evening, everyone. So we're going to start off with the Child Have Left program, which is run by 6 full-time staff plus in
full-time service from our principal environmental health specialist. In our table here are our primary case management responsibilities, and I do just want to note that in addition to serving the city, we also provide case management service to our surrounding municipalities in Mercer County, with the exception of 2 areas, and we also service several areas within Somerset and Morris County. So the numbers that are listed in this chart are inclusive of the entirety of our service area and our responsibilities. We did also break down some of that data for you so that you can see what we're doing exactly in Trenton. Along with our service areas, our shared service agreement denotes that we only provide nurse case management to any area outside of the city of Trenton, and we work alongside the inspectors and the environmental staff of those corresponding health departments. But for the city, we provide both the nurse case management and the environmental side. So one of our biggest accomplishments this year so far was our provision of free lead screening. We've done 4 events and have screened 65 children, all residents of the city of Trenton, 17 and under. So with our ability to provide this service, we're not only able to close the gap in access to lead testing, but oftentimes we serve as that first step in making sure that a child's whole scope of health is looked at. So we're going to continue on with that endeavor. We're also been working on streamlining our remediation and abatement process, so the removal of lead-based paint and lead toxins out of the home. And we've been able to accomplish that through key partnerships with organizations like ISLES, Green and Healthy Homes Initiative, and the Mercer County Hispanic Association, all of which give funding to residents through the DCA's LRAP program. So we've been able to funnel our cases to these resources to get that work done. We've also been working on enhancing our enforcement capabilities and ensuring that the city of Trenton has lead-safe housing here, and we continue our commitment to community education and making sure that our residents not only know the dangers and the impacts of lead poisoning, but also the best prevention measures. Moving on to health education and wellness, this program is sustained by 3 full-time staff members. We've had a number of events that we've hosted for the city this year, focusing on topics ranging from sickle cell to autism, mental health, breast cancer, and of course, lead. We've also attended a number of events this year through our partner organizations, which is key for us to share not only some relevant public health information, but also promoting the services that are offered from the Department of Health and Human Services. We facilitated 4 workshops, and I think our favorite one was with high school students, where we were able to present to the ESL class, and we were able to share on lead, and we also shared a lot on public health careers, and hoping to have some of those faces take our spots one day. We also this year launched our social media platforms through Facebook and Instagram. So through that, we've been able to develop some internal materials, and we also denoted the number of times we engaged on our platform so far this year. We also started some door-to-door knocking during the summer to promote our events and also just promote the services of the department to get some more interface with our residents. And again, we're also continuing to make sure we're educating our community, giving all the tips so that our residents can make informed and positive health decisions.
Thank you, Memphis. The other section we're going to be reviewing is the communicable disease reporting and surveillance program. We have 1 full-time nurse, and she has an assistant working with her. And the number of disease investigations that were completed year to date are 355. The outbreaks monitored 28, measles investigations 54, and animal bites 16. Some of the communicable diseases of note are norovirus, COVID-19, influenza A and B, hepatitis B, hepatitis C, malaria, campylobacteriosis, group A, streptococcus, ptosis, giardia, salmonella, varicella, and Legionnaires disease, which are some to be mentioned. Now, this is one nurse, like I said, that's doing all these investigations, and she does a very thorough job. Then I move on to environmental health, environmental and consumer health program. We have 1 principal, RAHs, and we have another full-time, so we have 2 RAHs, and we have a 3rd RAHS that assists us on weekends attendance basis. The number of permits that were issued here today is 956 permits. Retail food inspections, 745. Retail food re-inspections, 213. Non-food business licenses issued, 79. Temporary and special events, which we know Trenton has a lot, 337 events covered. Complaints addressed, 219. Notice of violations issued, 158. Illegal food vending, 41. Summons issued, 46. Pool inspections, 11. Youth camp inspections, 11. Tattoo and body art inspections, 4. Plan reviews, 45. Consultations, 146. And 1 inspection was done at the animal shelter in the month of August. If you look at the chart, you see the fluctuations, and you notice in the month of April and July, the numbers were extremely high because we did have a lot of events in the city, and the inspectors are out there many times, 6 to 7 days a week, inspecting to ensure that the public, that our residents are kept healthy, that when foods are being served at these events, they are at temperatures that will continue to have, foster healthy residents. The other section I'll be looking at is vital statistics. We have 1 registrar, and we have 3 other employees that work with the Office of Vital Statistics, and that office provides continuous official data on significant life events. The number of birth certificates issued were 3,842. Marriage certificates issued, 1,232. Marriage licenses issued, 505. Death certificates issued, 229. Dog licensing and registration, 539. Slaughterhouse licensing, 1. Communicable disease letters, 11. You might be wondering what are these communicable disease letters. As a health officer, I have to review the death certificates and send letters once individuals die and they request their bodies to be, families request their bodies to be sent to other countries. As a health officer, I review the death certificate, ensure that there are no communicable diseases on that death certificate, and then I sign to have that body sent to foreign countries. Trenton Animal Shelter. The Trenton Animal Shelter is the city's official municipal animal care and impounding facility operating under City Code 21-45 and New Jersey State Law. NJSA 4:19-NJ.A City, Chapter 8, 7:23A. Our mission is to provide safe, humane, and compassionate care for Trenton's stray, lost, or surrendered animals, while actively working toward every animal's best possible outcome, whether that's reuniting with their family, adoption, or rescue placement. We strive to perform the duties and responsibilities entrusted to this office with respect and sensitivity to the needs of the entire community. The number of intakes year to date, 440 animals. Adoptions, 253. Fosters, 41. Reclaimed, 167. That's significant. Rescues, 55. The number euthanized to date, 20. Adoption events, we had 17 adoption events. And the egress, which compares the amount of dogs or animals that were taken and as opposed to how many will be fostered or sent to rescue, 516. And if you look at the upper page on the animal shelter, the purpose for this is to provide temporary sanitary housing and care for stray dogs and cats, promote adoption, and provide public health education on responsible pet ownership, spaying/neutering, and rabies prevention. When you see how the numbers fluctuate, you look at April, you see that climb up to 60-something dogs. And then it comes down in June, and then stay pretty steady in September, It started going on today. I'm very happy to announce that we have 26 dogs at Trenton Animal Shelter, 34 at the annex, and 17 cats. So our numbers are constantly going down. We have to go. So our goal, I need to say this, we do have 5 grants, and these grants enable us to get the job done. We have the childhood lead poisoning grant that Memphis spoke about. We definitely need funding from the state, and that grant provides a lot of assistance with us getting these kids healed from lead poisoning. And then we have the Strengthen Local Public Health grant. The objective is to support infectious disease preparedness and response. We have the Public Health Emergency Preparedness grant to strengthen local public health preparedness, response, and recovery capacity and capability. Then we have the Enhancing Local Public Health grant, infrastructure grant, to support the development or expansion of long-term health infrastructure. Finally, we have the Sustaining Local Public Health infrastructure grant to sustain resilient and responsive public health system. Our departmental improvement plans for 2026 are as follows. For the Division of Health Promotion, our goal is to reach out to the community health clinics serving under or uninsured individuals by providing flu or COVID vaccinations, pediatric vaccinations, health screening, for example, breast cancer screening, HIV, STD, and also we want to do prostate screening at our clinics. We want to increase our community outreaches. We want to conduct school immunization audits. We want to develop web-based public health services directed to the city of Trenton. For the health surveillance statistics, we need to right now we need to replace our current cardiac system, which allows us to secure our vital records. For the Trenton Animal Shelter, we want to establish partnerships with animal rescue organizations to support placement of dogs. We want to ensure animal control officers and staff participate in continuing education to enhance staff competency and performance. We also want to enhance enforcement of the breeding ordinance in collaboration with the zoning division, the city clerk's office, and human law enforcement. Finally, we want to continue efforts to promote adoptions and responsible pet ownership practices. Finally, for environmental health, I did state that we have 2 full-time environmental health specialists, and they do an excellent job having 2 full-timers. But we want to recruit 2 to 3 additional registered environmental health specialists, and we also want to digitalize the documentation and reporting. And the database, we want to use a spatial data logic platform. In conclusion, I want to take this opportunity to thank our Director of Health and Human Services, Dr. Carlos Menefali, who is a leader that not only leads by what he says, he leads by example. And I think I have that awesome privilege of working with him. I thoroughly enjoyed, I think I've been here for 8 months. I want to thank the mayor, the VA, Dr. Carlos Menefali, for allowing me to function in the role as public health officer. My goal is to bring to the people of Trenton exactly what they need. I also want to thank every department that I've spoken about today, whether it's environmental health, there's some animal control officers represented here. They do an excellent job with ensuring that our residents are safe, whether it's dogs that are walking on the streets of Trenton, they go out and get those dogs. And I want to thank Mira Kamen, she's here, she's the registrar, who runs a department very, very thoroughly. Also, for health promotions, I want to thank Memphis, madam, who presented, does an excellent job as an educator. And I have the awesome privilege of working very closely with her as health officer. And also, the nurses that are responsible for communicable diseases. I just want to thank everyone, including you as a council of the Board of Health, because I know once you call, and many of you have called saying, I've seen a dog, a dead dog on the street, I've seen dogs walking, we've tried to respond as quickly as we can. And if there's anything else we can do to assist the City of Trenton to promote health, please do not hesitate to let us know. Thank you.
Mr. President, if you would like to have a question regarding
Just this
promotion portion, I think this would be the last one. I'm going to do more time, then social services are going to do the presentation.
Okay, we could do questions right now regarding this, and then we'll do social service. I mean, there was a question right now. Councilman Edward.
Thank you. Thank you so much for the presentation. Thank you for this information. Department of Health is vital to the city of Trenton. I know you guys wear many hats, many things going on in the city. I just have a couple of questions that I just wanted to address. Hopefully they're not too pressing. One question was,
Councilwoman, Dr. Diego is telling me he's having a hard time hearing.
okay. Is this better? Okay. So my first question I wanted to ask, with regards to birth certificates issued, I'm just curious because I know there's no birthing centers in the city of Trenton, no hospitals, so you're allowed to give birth. How were there 3,842 birth certificates issued for the city of Trenton?
The reason why we have such a word, we start from 1907. So we issue birth certificates typically from 1935 to present. We lost some hospitals, but people still coming back, especially now when you're real life need. Everybody's getting a birth certificate. They have to take a birth certificate.
So these are just birth certificates issued and they may be duplicates?
Yes, people have to replace them, especially now with the real life need and passport. They have to replace the whole birth certificate.
Okay, so there should be some clarity in that, because when you say birth certificate issued, that's normally an additional birth certificate at birth. So maybe it should be clarified that these are birth certificates that are also being duplicated, and not just new birth.
Okay, these are birth certificates are issued. They leave, people coming to get their records. So we have some homework, but very limited, maybe one or two that are new. But other than that, I usually just people that are getting replacements.
And even the one or two that are due, like how are they going to, we have to have a birth center used to allow.
Or they have homework. Every now and then we get a homework.
Got it. Okay.
Very rare, but we do get homework.
Okay. Thank you. I had a question about the Trenton Animal Shelter, the heat dress, that number, the 516. Can you clarify that a little bit more, where that 516 comes from, the heat dress?
So that would include the reclaims, the adoptions, the rescues, foster, all of that. This number also includes the number of dogs that were housed in European hospital in the city, and those are included there too. From January all the way to today.
Right, so, but the 516, I'm like, if you add up these numbers, if you add up intakes, adoptions, fosters,
reclaim 166, rescue 53. So that should add up.
So those numbers are different from what we have in front of us.
Yes, because those are up to date.
Okay.
Those are the ones up to date.
Right.
Yes. The ones, remember that at every end of the month I publish a data sheet, which is the prior month.
So let me ask you this, if it makes more sense. Then is the egress then, in your terms, is egress, how many animals have now filtered back out of the shelter? Is that what egress is?
Yes, yes.
Okay, okay, so any animals that come in that are now circulated back out for whatever reason, that is egress?
Yes.
Okay, that makes more sense, okay, thank you. I don't know if it wasn't explained correctly, but thank you, okay, that makes more sense, I appreciate that.
Sure.
And I think the one thing, so I do see that you see on the Trenton Animal Shelter what the plans are for 2026. I know we've had conversations in meetings, I saw the Councilman Williams about enforcing the breeding ordinance. Have you had conversations with other agencies about how to get this moving forward? Or is it just still an idea that, we have ordinance in place and we want to do it? Where are we at with that?
We are still in conversations to get help from other departments in order for us to enforce. So we cannot do it alone. So I need your help and the help of those other departments.
We're ready. Thank you.
Thank you. Councilwoman Louisiana, sorry.
Thank you, Council President. I'll be quick. Thank you for the presentation thus far. When it comes to the numbers that you have, like the permits issued and the food inspections and stuff, all of that have dollar amounts that coincide with it, right? We generate revenue from this, right? Yes.
Yes.
So I think just to be helpful as we move forward, as we look to tie back to financials and stuff, just to show what that looks like in terms of dollars that you're doing, right? Because if we can quantify exactly what's happening to see the benefit of what it is for all of this, right? For all of the licenses issued, for the marriages, anything that we give you money for, next time we piece it together, if you could show the dollar amount, that would be greatly appreciated. Thank you. That's all the questions.
Thank you, Councilman Williams.
Thank you very much. I just want to quickly say, what Luciano just said, and then also about the regarding Councilman. So there's two quick questions. One, I saw the number of dog licenses was 539. Is that an increase or an increase from last year you have now?
Of egress, sorry?
No, is it an increase, the number of dog licenses?
Right now, but we can give you the number.
Yeah, that would be good, so you can see what trending is, because I know other departments been very, very active in trying to get more and more information out, more adoption events, more rabies events, and hopefully that's also turning into more people having a dog license and,
Absolutely.
and I just another question I wanted to ask regarding HIV prevention, because I didn't see that listed in this. Any statistics on how we're doing with HIV prevention, and also, and this going forward, because it cuts at the federal level, it is an infection and AIDS is a disease that doesn't just affect the LGBTQ community, it affects everyone. I'd like to know what plans may be, not now, but in the future, regarding our reaction, how we'll handle funding cuts from the federal government for particularly HIV prevention.
The plan is for 2026 to bring those services back to 218 North Broad Street, which is our clinic, and then we're going to be doing the screening portion of it, our mandatory screening portion of it, and then hopefully we'll be able to find organizations that are going to be able to do referrals to, and then the treatment and continuation of the treatment and of the patient. As of right now, other organizations are doing our screening, such as Gary Jails.
So do you have a department inventorying into that experience, we told at the ER, and you don't need to necessarily get radio shots because it's the observation of the animal. And having staff say, no, it's a pretty precautionary, I think you should get it. I think that's very encouraging. I just want to say, keep on with that, because that's important.
Thank you. Just one quick question before we move on to the next portion. I know she stated that we have one nurse that was serving. Is that, do we need more? Is that too much for one person to handle, or do you have any vacancies that need to be filled?
It's a lot, but we're hoping to get another nurse, who will be coming from another department to assist us with investigations.
So that's already been put
And
out.
we're also planning to do cross-training of the other nurses, because we have nurses providing Medicare, but there's not going to be lead nurses or communicable disease nurses. All the nurses are going to be cross-trained.
Thank you. All right. We're ready for the next portion.
This section is for China.
Good evening. I am Janet Porter, and I am the interim director of the Division of Community Relations and Social Services. Organizational chart. The Division of Community Relations and Social Services is dedicated to enhancing and improving the quality of life and well-being for residents of Trenton. Specifically, we engage in marginalized populations in the city of Trenton. There are 5 functions under our division, which is Adult and Family Services, the Office on Aging, Emergency Services and Responses, the C Center, which is the Coordinated Entry Assessment System, and the Continuum of Care. The Adult and Family Services Unit. Between July 2025 until the end of September, there were 9 additional families who were assisted with personal time, bringing the total. It is my understanding that you received information and numbers prior from January to June. So the numbers I'm giving now will be from July to September. So the additional 9 that occurred between July and September brought the current total of assistance for personal interventions to 71. There were 14 families between the same time period that were assisted with background to prevent homelessness and evictions. There were 20 emergency placements between the same period, bringing the total since January to present to 92. And case management services, 37, bringing the total to 282 families that were served. The Office on Aging. Our Office on Aging provides socialization, recreation, and support for Trenton senior residents ages 60 and older. The unit is funded by Mercer County Title 20 and Title 3 grants. The grants enable our staff to provide transportation to and from the senior centers and to provide medical transportation to seniors age 60 and above. In addition, this funding also covers nutritional support at our 4 senior centers. Accomplishments to date with Office on Aging. We have 4 centers, the Reading Senior Center, St. Naples, Jimmy Stubblefield, and the South Ward. Reading Senior Center, the number of seniors service during the same time period, and that should say July to September, 429 seniors, and those are duplicated numbers. St. Naples Center, 728 senior service. Jimmy Stubblefield and South Ward, they're in the same buildings on Prospect Street, 442 and 400 respectively. Bringing the total number of seniors that have been serviced since January of 2025 to present, 2,767. So you can see that we are making an impact with seniors in the city. I'm going to show you some highlights from some of
centers, the Reagan Center, which is temporarily relocated, by the way, at 205 North Clinton Avenue. The center will be undergoing renovations under county funding finally. The Reagan Center, the first photo shows intergenerational engagement. We had youth from the summer programs, teenage summer programs, that engaged with seniors at this center. And what they did was they played cards with them, they played bingo, they played billiards with them, they had discussions with them. So that was really exciting. And we wanted to highlight this. This is something positive. Another event was a Labor Day barbecue event that the seniors got together and did for themselves. Okay, so good fellowship. And finally, one of the events that the senior centers, what they do is that they go on trips. There was funding received from Mercer County called MC2, which is part of the ARPA grant. And the ARPA grant allowed the senior centers to take trips, to use scouts to go out of town to take trips to see plays, to go on like Spirit of Philadelphia, Spirit of New York. Well, this last program here showed seniors from the Reagan Center, they took a trip to Patterson to see but they took a trip to Patterson and the president went through. James Stubblefield was out the north. These are photos from a senior cooking classes. These are some activities that also took place. We had ABC Dad Nights that came in to provide cooking classes for at each of the centers. And this particular one is highlighting James Stubblefield, where the on the menu what they served was seafood and stir fry. You can see the mayor included in that picture with some of the seniors. So they were very excited about that activity. Finally, the San Naples Center, last week they participated in a pottery class. So we try to bring different types of events to them, in addition to the bingo and educational services. We had a there were 5 or 6 seniors that participated in this activity, and the gentleman will be returning tomorrow so that the seniors can paint the projects that they formed last week. So it was very exciting. Unfortunately, all the seniors did not participate in this, but when the majority of them saw those few, it was like, oh man, I wish I had done this. So this is, I want to highlight some of the activities and different things that we can offer the seniors to engage with, and things that are very accumulated, things that they go from. Our emergency services and response system of the Communications and Social Services. This unit provides response to recovery for disasters. We work closely with the Office of Emergency Management. During inclement weather, last week there was a state of emergency. We had to have there was a state of emergency. We had to have all hands on deck for the anticipated state of emergency rescue that was going on state. We mobilized for terroristic threats and public health epidemics like Ebola. We also coordinate emergency response teams. As you can see on the slide, we have prepared cold red and cold blue emergency shelters. Cold blue emergency shelters are done during the blue is for the winter months, and the cold red shelters are implemented during the heat. We also, the most recent event that we had to coordinate emergency response for was the fire that we had on North Golden Avenue. And at this time, I would just like to say that I would like to give a shout out to my staff. They were awesome, and also to Councilwoman Tessa Frisbee and Nasmanelli coming out to support. We were able to open up a shelter and where the families could gather together to heal and to comfort each other. And during the time, we had the shelter open for 11 days. And we provided different services. We were the counselors for the teenagers, we were the counselors for the adults, We brought in, people that are frontline consent. We brought in the consulate that came together and passports and IDs. Marina's office also helped with IDs. The community mobilized together to provide meals on different nights at the center. There was an outpouring of clothes. However, many people, they couldn't use the clothes, but we were able to collect, our office was able to collect over $6,000 in gift cards that we gave to the different families. And as recent as last Friday, we received an additional $2,000 in gift cards and gift to the families. And also, we were able to link them to a provider that came to the center. And I am so proud to say that they all have received permanent housing at this time. So, I want to congratulate myself. Functions, target population of chronic homeless individuals unaccompanied by children, ages 55 and plus that reside at the rescue mission. So seniors who reside in the rescue mission. And also we are identified in the Trenton versus COC for conducting local outreach to engage unsheltered individuals experiencing homelessness. The second group of individuals that offer services are justice impacted individuals who are recently released from incarceration. And it is our honor to serve these populations. That community and social services, we are tagged exactly with having our hand on the pulse of the people that's in the city of Trenton. Many of the people that we see are in need of housing, just like the shelter that we talked about, the animal shelter. They need housing, they need support, and we are very proud to be able to enhance the quality of people's life in the city of Trenton. So we're very glad that there's a group of vendors and providers and community support. Within the coordinated entry, and I want to talk about homelessness right now, there were 15 people between, let's just say July to September, that were assessed, bringing the total from January 1st to total 36 people that received assessment. That number is very low for the season. We normally would have better numbers of like 60 or 70, but because of staffing challenges, we are not able to engage as many people that's experiencing homelessness. Our permanent housing placements are 28 to total. Between the time period of July to September is 9, and the referrals to permanent supportive housing are 12, bringing the total to 6. The difference between permanent housing placements and referrals to permanent supportive housing placements is that permanent supportive housing are vouchers that are financed through HUD and through COC. And those housing placements are providers are Catholic Charities, those integrated, the rescue supportive housing, and we have our Health and Arms that provides housing for individuals that might be justice impacted. The coordinated entry system between January to September, 28 total housing placements, 26 permanent, and compare that with last year's during the same time period, and thank you. We have 33 permanent housing placements were made, and this represents a decrease of 5 placements, so approximately 15% fewer placements. And again, that's due to staff. And not just staff with the C Center, but also we see that with our partners, Oaks Integrated and Catholic Charities. Expectations and projections with the coordinated entry system. Due to ongoing federal funding cuts, limited housing availability, and increased rent and low income, the capacity to place individuals into stable housing is dim. This will result in longer wait times for housing placements and increased levels of homelessness, especially in the city of Trenton, unfortunately. Future recommendations for the coordinated entry to establish memorandums of understanding with housing authorities to streamline the application process for eligible clients. And that should say for eligible senior clients. We're beginning to see an increase in the number of individuals aged 70 and above that's residing in cars and that's experiencing unsheltered homelessness. Many of them are on wait lists for housing authorities, but sometimes it doesn't matter that they are on the wait list, so we're suggesting to create or work along with the housing authority and legislators to create a prioritization for older individuals who may be experiencing unsheltered homelessness. Another recommendation is to seek alternative funding sources from local, state, and county entities to supplement the federal shortfalls for the vouchers, and also to support the construction of affordable housing. Finally, to strengthen partnerships with our existing housing and service providers to improve the coordination toward quicker housing ability. This last point I want to talk about, strengthening partnerships. Recently, the City of Trenton was able to, with the coordination of the Trenton Police Department, Department of Recreation, and Community Relations and Social Services, the city partnered with Mercer County Board of Social Services to be able to relocate an individual that was living across from Mill Hill Park for 2 years. We were able to, with dignity and respect, relocate that person, store her belongings in a place where she has access to them, currently check on them. She's been in a motel that was funded by Mercer County Board of Social Services, another government entity, another partnership. And I am so proud to say that she's going to be housed November the 1st. She's going to have supported housing. So this is government at its best. You know, we talk about other things, but like I said, this department, we have our hands on the pulse of people, the people that live in this town. The Office of Returning Citizens, also ORC, we serve as an entry point for justice-impacted residents returning from incarceration. Through our partnerships with the community, private, and governmental agencies, returning citizens are linked to employment opportunities and training. The office is staffed by a reentry specialist, one social caseworker, and a bilingual keyboarding clerk under the supervision of a CSIM director. The major accomplishments that we've had in this office with very little funding, we are able to offer hands-on certification and hands-on forklift. When I first took over this unit, the only type of forklift training that was offered was for classroom. And through a very creative staff person of mine, I'm like, why would we just pay for the classroom? We could take that money, get free classroom training from the Department of Labor, and use that money to rent a forklift. So that's what we do now. So we offer the classroom training the same day from the Department of Labor. They come to the parking lot out here at City Hall, and then people are getting their certification. So that's an awesome thing. Another certification that we're putting, that's the next page. We also offer expungement clinics. We've had, the last one that we had was last week. Rakia Blackwell, an attorney, Rakia Blackwell has been coming to conduct expungements for people at the C Center. We're very proud about that. One of our major goals is to identify additional partners who will work with justice-impacted residents. Also to identify additional funding to connect vendors, because we would like to offer welding, construction certifications. We also want to do CDL training for people, entrepreneurial training for people as well. And in addition to that, we want to reapply for the New Jersey LEAD funding so that it will allow us to enter into institutions to be able to connect with people directly. Intakes completed, these numbers are high. We've seen since January 330 people, 300 justice-impacted people in the city of Trenton. 300, okay, so you can see that there's a need there. How many people obtained employment. That's very challenging. At this point, we're working on that, 35 people thus far. In November, we will be hosting an employment-focused job fair for returning citizens. Training sessions offered, 21. There's a variety of those which I'll touch on. Participants that completed those 21 training sessions, 238 people. And we've had, like I said, 4 expungement clinics so far to date. So we're making impact here. And these are some of the trainings that we have, the certified forklift trainings that I mentioned. Future dates are in front of you. Renewing the mind, workforce development. Workforce development is a very important component when you're working with justice impacted individuals, because it allows them not only to get a job, but helps them to sustain employment as well. Empowerment House, anger management. And the other certification that we offer is Serve Safe training. Certification is good for 3 years. So we are trying to do impact, we're trying to be relevant, offer relevant trainings and employments for this population. And we were also, the office was also accepted into the Mercer County Reentry Workforce Coalition. So we are a major player with that as well. And that's not the county government, it's a private entity that's called the Mercer County Reentry, because it's made up of a representative from Chase Bank and Workwell. They kind of spearhead that, and there's many stakeholders that work with that population that are part of that. But the city, at one time, they would not accept government entities, but because of the work that we're doing, you see that we're committed, we're allowed to participate. The final component of the Community Office of Community Relations and Social Services is the Trenton Mercer Continuum of Care. And that the Continuum of Care is comprised of 75 members and 30 organizations, including representation from government, local government, homeless service providers, people with lived experience, and a broader community of businesses and faith-based groups. What does it do? The Trenton Mercer Continuum of Care organizes housing services and addresses the unique requirement of persons experiencing homelessness. The functions of the COC, there's a board and committee management, there's resource coordination and planning, HIMIS operations lead, and funding applications. The board and committee management team consists of the executive director of Mercer County Board of Social Services and the deputy director of the Mercer County Department of Human Services. They are the heads. And then we have the City of Trenton Department of Health and Human Services. We call that the 3 Gs because they are the 3 governmental entities. We have resource coordination and planning. A lot of this is tied to the C Center under that coordinated entry. We have the HIMIS Operation Lead, which is the database that the state uses. And then we funding for homelessness. Now, the fiscal year 2023 amount is up here, but the fiscal year 2024 just came in, and the COC just received $6.1 million for 2024 to go ahead and address homelessness and supportive housing. And the impact of the COC, we provide support to single individuals, they assist families, they help chronic homeless individuals suffering from mental health issues, and they support children, veterans, and youth. And that's it. Thank you for your time.
Thank you so much, Ms. Porter, for all that. And thank you for all the work that you continue stepping up to be an interim. Are there any questions?
Council President.
Councilman Feliciano.
Thank you. So, Ms. Porter, wonderful job, great presentation. Thank you for all the work that you and your team have been doing. Certainly it's nice to hear about it and then be able for us to see what it is that is taking place. So when it comes to our senior centers, right, just, excuse me, because I've been around and seen and participated in some functions, how do we recruit for the senior centers? Like, how do we get them there to the different ones? Like, how do they know?
How do they know about it? Mm-hmm. Through word of mouth. We also go out to the community, we table at events, and go to churches. coordinator of social services.
Good evening, Council. When it comes to recruitment of our seniors, there are different ways that we go about it. One, as she stated already, that we go through churches, word of mouth. But usually what we do is we have throughout the year we have different extravaganzas. One is the month of May, which is Seniors Month. So a lot of times we will hold different type of improvements at each center. And what they do is, usually they are allowed to bring one person with them from the outside, and then we also invite the outside. And it's usually a day of activity, games, things of that nature, letting them know what we offer as far as services. And usually it's like the medical, the nutrition programs that we have, things of that nature, and the activities and the travel that we have. So that encourages a lot of them to participate and also reach out to others. Now, at this point in time, due to size restrictions, we actually kind of have a waiting list, in a sense. So it is working. And as you noted, most likely sometime in 2026, during the summer, we will be able to possibly open up our Reading Center, which is a much larger venue here on 15 Greenville Street. And South Ford Center is also in the midst of being under construction to reopen, because currently there are two centers that are together, which are South Ford and Jenny Stubblefield, which is located on 301 Prospect Street. And so, yes, we are making a lot of progress, and hopefully by that summer, we will.
And then from us following along and everything, you get different grant funds and things, as you've said, to be able to have all your events and things like that. So back in 2024, we had passed an ordinance for a senior citizen advisory board that we wanted to have put to bring about, to have. That still has not happened. And then this, you wouldn't know, is that when I had brought it up again, after bringing it up again and again, and having people actually say, well, never mind, I don't even want to serve on it because no one ever got back to me about it. One second, is that the mayor had actually wrote back to me when I said about what are we going to do, and said, well, basically, we don't have, the money for this. Where do you suggest we get the money from? And so my thing is, it's not about the money, because we have the money. It's about access. And so I'm just asking yet again on record tonight that we make that happen. There is no reason why it cannot be. There is no reason why it should not have been. And again, when it comes to the funding, when we're talking about our seniors, at one point in time, we were arguing for seniors when we were comparing to what we were doing for animals in comparison to seniors. And now you're saying that we can't do it for the seniors because where are we going to get the money from when we already have it? So I'm just saying that in light of all the great works that you're doing, I would like the director, Diego Manicapelli, to make the Senior Citizen Advisory Board a real viable, functioning board. It should have been, it needs to be. Again, it's about giving them the access and a voice at the table to speak about the different events that you're having, to recruit other people in, and to be able to touch the lives of other senior citizens that are around.
You're absolutely right, and I'm glad that you spoke on that. I had an interview yesterday with someone for this senior advisory board that you're speaking about. But I also agree with you that funding should not have anything to do with the creation of a board, to be able to get ideas from other seniors that's going to service seniors citywide. So while I am here, I will definitely make that a priority. You can put that on record.
Thank you. I appreciate that very, very much, because we've been waiting. And then I also want to shout out, excuse me, Dress for Success. Melissa Tenzer and I, after I found out that we could go into the center where the people were after the fire and everything, Melissa and I serve on their board of directors. We went and actually showed up, not in the evening while the people.
Officer Brenda Roberts, the interim director, Janice Porter, and to your entire staff. I just want to tell you, great job. This was a thorough presentation for your annual year. I greatly appreciate all of the work that you put into presenting this to us. There's a whole lot in here that I didn't realize the numbers were, even some realizing that we had, of course, about shortage in the staff, that we were not able to service as many as we normally would. But with what resources you did have, I appreciate you and I applaud you for what you have done. This is what community looks like when we work together to work with one another. This is how we grow and we expand, and it is especially heartwarming to see that the woman will have her own place who has been displaced for so long. That's what we are about. That is showing compassion. That shows the heart of the city. So I just want to say thank you for your hard work. I know it's not easy because it can be emotional and we're not supposed to show that at times. But at the beginning, the start of the day, we're human. And I thank you for your work. I appreciate you. The city itself appreciates you. And we are better because of how you are making sure that every T is crossed and every I is dotted. So thank you.
Thank you for your support, and I want to thank Dr. Manakapelli for support as well, and for an awesome staff that we have. Thank you.
Thank you very much, Council President. So I just want to also say wonderful presentation. Thank you very much for including everything and getting into granular detail on some things that you do, because that's very, very important, particularly since Health Department encompasses so many things in our city. It's incredible at times. So I just have a couple of questions. And I'm really glad that Councilwoman Feliciano brought up the Senior Advisory Board, because it has been a major frustration to not have this be an up and going concern since she originally proposed it. I've helped to try to recruit some of the members for the board, and it's sorely needed. So I really hope going forward we will be making sure that they start meeting and well before the end of the year, because the idea that money was involved, as you said, it has you don't need money for this. You just need time and an ear to listen and a hand to write notes. And so what do you want? Which brings me to just two quick questions. One is, what other activities would you like to be able to do? I know you have a limited budget for our seniors, including trips, because I heard about the trip, and yeah, there are a lot of good stories from it, a lot of good energy, and a lot of positivity.
You asking what other trips or what other things?
Yeah, what would you like to do if you had the chance to?
Okay, I do have to say that we are going to get some additional funding from the county to provide computer classes and embroidery classes and sewing classes. What do you think the seniors will like? That's what we need a board, right?
Exactly. I just wanted to ask Ms. Porter for her vision. What would she like to do? That's different than.
I'm in the process of kind of revamping the centers and more educational components, empowering them with skills, technological skills, so they play a lot of bingo, they're sedentary a lot. The trips are great, the new infusion of activities like the pottery and the cooking class and the Tai Chi, bringing more educational things, sort of like risk of scamming and technology-based projects.
Education.
Yeah, but they really enjoyed the trips. They went to the cruise in New York, you know, they dressed up, and Spirit of Philadelphia. But I am 65, so I guess I'm a senior as well. But I am looking forward to working with and getting input from other seniors from the city, in addition to seniors from our centers, to get their input in fairness, to let them tell us what it is that they would like, and so that we can support them.
Okay, excellent, thank you. And my last question is, I don't know exactly if we do this, but I know, once you turn 50, within a week, AARP has an envelope at your house. So do we do anything, or could we do anything similarly when someone's turning 65 and they come apply for a dog license or a birth certificate or whatever they need? If they're not in our system, to get sent information on all the things that we do for seniors in the city. I think something like that might be very helpful and publicizing, because we don't have a dedicated channel like we used to have channel 20, I think it was channel 19 on Comcast, would have public service announcements and other things. It might be a way to immediately connect the new seniors.
Also with taxes too.
Yes.
Taxes and water, yeah.
Yeah, that would be great if we could do something like
It
that.
might be at the department director's meeting conversation, right?
I hope to hear some good news that you had that meeting, and if we ever have an opportunity, I'd love to chat with you further.
I would like to.
Thank you. Thank you, Council President.
Thank you.
Councilman Figueroa Kentberg.
Thank you. Thank you for that. I mean, this is the best presentation that we've actually had before us since we've been city council people. I would say for myself, I'm sure my colleagues would agree. Lots of great details. There's so much covered in Department of Health and Human Services, so really thank you all so much for this. I just want to say, thank you to Jenny Stubblefield for housing our South Ward seniors. They've been housed there for so long, and I know that our South Ward seniors are excited to return home soon, and I know that it is in works. Mercer County is assisting with that. I cannot wait for that, be a convenience for our South Ward seniors. And also, I just wanted to state that Trenton Baseball also did make a significant donation for the fire victims. They did bring it to the fire department, and I just wanted to acknowledge them for that. Thank you.
Mr. Garcia, ready for public comment?
Certainly, Madam President. At this time, we have public comment. This public comment will be for Board of Health matters only, just for the purpose of the Board of Health meeting. If I could have a public comment, clipboard. And Madam President, I'm going to call names off, but at the same time, it does appear that this is for, I would imagine these individuals who have signed up for public comment for the next coming public meeting. If that is the case, please do indicate so to the public. Ebony Day? Is that for the next meeting?
Yeah.
Thank you. Victoria Rosari? Is that for the next public meeting, or is this one for the Board of Health items?
Next public meeting.
Thank you. Is there anyone here for public comment for the Board of Health meeting only? Hearing none, Madam President, we can move to adjourn if you would like.
Yes, may I have a motion to adjourn?
So moved.
Thank you, Vice President Edwards.
Yes.
Councilwoman Feliciano.
Yes.
Councilwoman Figueroa Kettenberg.
Yes.
Councilwoman Frisbee.
Yes.
Councilman Harrison.
Yes.
Councilwoman Williams.
Yes.
Council President Gonzalez.
Yes.
Motion carried. Board of Health meeting is adjourned.
Thank you.
And to the public, I believe, and Madam President, correct me if I'm wrong, we'll be waiting until 6 o'clock to begin
It is past 6.
the public meeting, correct?
Yes, but we can
Thank
begin. Everyone okay on council? No need a break, nothing? We keep going. We can start the next one.
Moving on to October 21st, Trenton City Council